All right, Jenny, are we ready? Good afternoon and welcome to Travel in the Time of COVID, presented by Emory Atlanta 60 Plus Network. On behalf of the leadership team, I want to say that we're glad that you're here. I'm Kevin Kell. I'm an alumnus, Oxford College, 1975, Emory College, 1977. I'm also a staff liaison to this network and to two others. 60 Plus Network launched in March of 2020, and in its inaugural year, it produced 14 digital events, cultural, intellectual, social, educational, everything from how to draw to estate planning 101. And I hope that you'll join us for future events. 60 Plus is one of 15 Atlanta networks that are affinity, identity, or age-based. And hopefully there's something there for everyone. Before I turn the program over to John Lilly, who is the events chair, I want to encourage you to come to Homecoming 2021, excuse me. It's in person this year and on the quadrangle, Saturday, October 23rd. You can register at together.emory.edu. There are going to be fun events, beverages and food, and 60 Plus will share a tent with Society of Corpus Christi REM. So come by, say hello, let's hear your Emory stories, and pick up some great Emory swag. With that, I'm going to turn this over to John. Thank you, John.
Thanks, Kevin. I'm John Lilly, Emory College 67. It's my great pleasure to introduce Dr. Henry Wu, who's agreed to talk to us today about something that all of us are now concerned about, or have been, or will be. Dr. Wu is an infectious disease and epidemiologist, an associate professor and senior physician at the Emory School of Medicine. He's the director of the Emory Travel Well Clinic, which is Emory's Travel Medicine and Tropical Diseases Center. He's directed Emory's COVID-19 clinic and testing centers during the past year or so. He previously served as an epidemic intelligence service officer and medical epidemiologist of meningitis and vaccine preventable diseases branch at the CDC. His interests are infectious disease epidemiology, tropical diseases, travel medicine, and the evaluation of patients for serious emerging infections. Dr. Wu today will talk about the current state of the pandemic as it relates to travel. He's going to cover the risks inherent in different kinds of travel, self-protection that you should take, vaccinations, entry requirements, and other things you should consider as you plan your trip. A couple of administrative things. If you have questions, please put them in the chat, and I'll read them to Dr. Wu as we can. Of course, the event's being recorded, and this presentation is sponsored in conjunction with OLLI. We hope to do many more of these joint presentations in the future. Dr. Wu, you're on. Thanks again for joining us.
Thank you, John, for that introduction. And I'm going to share my slides. So give me one moment to do that. Let's see here. All right. Can everyone see my title screen there?
Mm-hmm.
Okay. So thanks for the introduction. As you heard, in usual times, I spend my time in clinic advising travelers, weighing risks and benefits and how to protect themselves during a trip. Obviously, that travel is way down during COVID, and so I've transitioned a lot to a lot of COVID-related work, and I've directed our COVID treatment center, for some time now, and certainly have gained a lot of experience in preventing this infection. So I certainly have a lot of thoughts on travel, and hope to help you folks plan your trips ahead, or even decide if you should travel. So. And then I'll certainly try to leave some time for questions, as and because I'm sure there will be a lot. So let's see if I can advance this here. Okay, so goals. I'm going to give you a kind of a general overview. Really, I'm not going to go into too many details on what's going on in the pandemic, but certainly that's sort of one of the key sort of things to consider. I'm going to try to give you the tools to protect yourself if you're not already familiar with all of them. how I approach assessing a trip. How risky is it? Other things to consider as you plan your trip, and in short, give you a framework so you can make your best decision on travel, based on current knowledge. A few caveats: I cannot predict the future. I mean, obviously, this pandemic has ebbed and flowed and flared up in very unexpected ways. And certainly it will continue to do so. So as much as we try to think we can sort of have an idea of what's going on next 2 or 3 months, I think at the end of the day, there's just still a lot of uncertainty. Finally, I cannot tell you if you should or should not go on a specific trip, because in the end, it's a very personal decision, weighing the risks and benefits that are very individualized. Certainly, if you have a very tough call to make, then that is a good reason to see either your physician or a travel medicine specialist, like the ones we have in our clinic, to help you sort through your very specific issues. So in short, it's a risk-benefit analysis. And when I say risks, and this applies even before COVID, any trip, going on a safari, even just, going on a camping trip, what are the risks potentially to your health? And it's very specific individually, whether or not you're elderly, whether or not you have other medical conditions, whether or not you're vaccinated, to the health of their family, the people you're visiting. So certainly, maybe you are not too concerned of yourself, but maybe the people you're with or you're visiting may have risk factors that you need to watch out for. There's also, in public health, we think not just of ourselves, but also the community. So certainly, there are thoughts that you might think of, are you putting, the community you're visiting at risk? Are you bringing risks back to your home community? It's less an issue now that COVID is just about everywhere on the planet. On the other hand, as we have emerging variants and things like that may become more of a thought again. Certainly plenty of practical consideration, risks of, delays in your travel, of getting quarantined, mandatory isolation. What if you test positive, and it's really a time that's, some acceptance of these hassles are going to be inherent in travel. Now, of course, what's the benefits? Of course, why are you traveling? What's the importance of the trip? Whether it's, the personal importance to see folks, your family, to be there for somebody, whether you just need a break. So question is, how big are these risks? And a key point, how well can you mitigate them? Because I do feel strongly that we do have a lot of tools to help mitigate the risks of travel. And again, weigh that against how important is this trip, and a key question: are there alternatives? Are there less risky options? Do you have to travel at all? Are there types of trips you can do that will reduce that risk? Is there a compromise? So that's the basic framework to really consider any trip. Key point or key consideration: how bad is the COVID rates at your destination? And in short, obviously, if you're going to a place with high transmission rates, higher than what you're experiencing at home, that probably means the trip will put you at higher risk for infection. But it's not just about your personal health, but when you start approaching extremely high rates, overwhelmed health systems can be a factor. So even if you are vaccinated, not likely to become sick enough to be in the hospital, you may need the hospital for other reasons. And certainly in our own country, we've had periods, even here in Atlanta, where our hospitals and ERs were quite overwhelmed. At this point, there are certain parts of the country, other parts that are experiencing that. Certain parts of the world have experienced that, and it will continue to happen as this pandemic, flares up in certain parts. So I think that's an important consideration. Now, a couple caveats when you start looking at those maps and rates of infection. Surveillance data is inherently incomplete and delayed. So, what's flaring up, if the data suggests there's a flare up, well, in a few weeks, that situation may be different. A place that looks quiet may be, heating up by the time you get there. So, unfortunately, the data is not real time. There's always a delay. So, but I do think you can get some ideas and trends by looking at it. obviously the risk at your destination says little about the risk during transit. So I'm talking about airports, the drive, the bus ride, et cetera. And it's particularly because in those situations you may be in contact with people from all over the world, so it's a little harder to assess the actual risk in those situations. But the good news is in those sort of transit situations, you can take a lot of precautions to minimize your risks there. And finally, you may realize that, yes, good news, where you want to go has a very low risk. But again, kind of question about, are you putting that destination at risk? So, and this is obviously a challenging question sometimes, because often these destinations are very desperate for travelers. If you're talking about going on vacation somewhere, and you may have their tourism industry begging for travelers and their public health experts saying, please don't come. So we've seen that happen many times. So these are questions without easy answers, but things that you might consider. This is just the epidemic curve of what we've been seeing in the US since this all started. This would be the large peak we saw last winter. Which then came down. Of course, the large peak we've seen this past summer, which fortunately is coming down. What's up ahead is, I think, a real hard to say. I think, we should be prepared for the possibility that things rise again and we get another winter peak. Presumably, it would be smaller than last year's, given the amount of vaccination we have, as well as just people who have been naturally infected. So again, approaching more of a semblance of a herd immunity. There's some models that predict, that our numbers will just continue to drop through the winter. And again, that's assuming we are reaching herd immunity. I think there's a lot of unknowns. So I think it's, again, this is one of the tough parts about planning winter travel. If you're booking your tickets now, because I honestly can say, as epidemiologist, I'm not sure what the winter is going to look like. I think the one thing I can say is it's probably not going to be nearly as bad as what we saw last year. That's the good news. This is just the current map. Again, a snapshot from the CDC of the rates going on in the US. As you can see, flare-ups right now going on in Alaska, sort of the upper Rocky Mountain states, West Virginia. But again, this tells us what the surveillance data is telling us at this moment. It doesn't tell us what's happening next week necessarily. And again, a key point is that we're a big enough country that certain parts experiences flare-ups in different times. So this makes planning a little challenging. What's going on in the world? I'll reference CDC a lot. If you're not familiar with CDC's travel website, as well as its COVID information, I encourage you folks to visit it regularly when planning trips. A lot of good information, and they do certainly, I have many colleagues who are still there. They do certainly try their best to synthesize the best available data to make their recommendations. My understanding is they are preparing kind of winter travel advice, holiday travel advice. So stay tuned, as they put out more guidance. And they also sort of give risk assessments for each country in the world. And this is the current map. The good news is parts of the world are actually lower risk than the US. The bad news is we're been having pretty high rates here. So that's why our country is all red. But as I showed you in that national map, we're not all equally affected in the country. But again, this all changes week to week. Let's see here. Move to our next slide. So as you're preparing, what can you do in advance? I'm not, above all else, please get vaccinated. I'm going to hope majority of folks are vaccinated. If you haven't, I strongly recommend it. Certainly, the booster recommendations are kind of incrementally coming out. Certainly get that when it's available and recommended. I'm not going to dwell too much on the vaccine, except that it is by far still one of the best preventative tools that we have. It's proven to be very safe. It's highly effective, especially if you talk about keeping yourself out of the hospital and dying. It may not be perfect in preventing all infections, but in terms of preventing the worst outcomes, it is still your best bet. So I strongly encourage it for all travelers. And this is one of the single most important things you can do, whether or not you can travel or you are traveling. Secondly, internalize, the habits. Now, vaccines are great, but it doesn't mean we throw everything else out the window because, as I mentioned, vaccination is not perfect. So that includes masking at higher risk situations, and includes respecting distances, both, protecting your personal space, so social distancing advice, recognizing risky situations. So I'm constantly, when I'm out, assessing a situation, does that place look too crowded? Does it, is the ventilation good? And I'm making constant decisions. Should I stay here? Should I move on, etc. Hygiene, of course, hand washing is always important. As you start to consider destinations, review, not only the status of COVID, but, the requirements. Are they allowing travelers? Well, you need to get a test in advance. Are they requiring vaccination? If they're requiring a vaccination, how are you going to prove it? Are they have their own specific sort of passport or some way to upload your information? Even if it's not required, you might consider pre-travel testing and even a quarantine period. So this is something. Say I'm visiting my grandmother who is very frail, even though she's vaccinated, she has health issues. I really want to do everything possible to protect them. Well, maybe I'll, in addition to getting vaccinated, I might test myself before my trip just to make sure, I'm not carrying something I don't know about, even testing after I get there. If you really want to minimize the chance, I might even try to isolate as much as possible before my trip for a couple of weeks, minimize that chance that I get unexpectedly infected. I know this is not always possible, but certainly, again, these are things that you can do to add, layers of protection. And don't forget, finally, the routine travel preparations, whether it's other vaccinations, if you're going overseas, and just routine things like the flu shot. Again, the flu shot, pre-pandemic, I used to tell our travelers, who come to our clinic, the flu shot, ironically, you're coming here for yellow fever, typhoid vaccines, cholera vaccines, but ironically, the flu shot is the one I'm offering that's most likely to save your life this winter, and that advice obviously changes this year because it's now the COVID shot that's most likely to save your life. But again, I wouldn't throw the flu shot out the window yet. I think the flu season, what it's going to look like this winter is still up in the air. We don't really know. We certainly had a light one last year, but things are very different this year. Certainly parts of the world may need other things like malaria prophylaxis, et cetera. So particularly for those exotic overseas trips, check the recommendations or contact, a travel clinic like ours. So key points on transmission. I think it's important to understand how COVID is passed, and primarily because this really, again, helps inform how you do things. We have made it figured out quite clearly now. It's primarily person to person through the air, and through either large droplets or smaller droplets, what we call aerosols. There's a lot of debate initially about droplets versus aerosol. The point is that 6-foot rule is just recognizing that most of those larger droplets, basically that's the spit you can see coming out of somebody's mouth when they're talking or sneezing, those drop pretty quickly. And that's why staying 6 feet away kind of protects you. The bad news is there are smaller droplets or microscopic aerosols that float farther. Either because they're just generated while they're talking or breathing, or maybe some of these larger droplets evaporate and then they just leave kind of floating particles in the air. That's the bad news. Those can travel far. But here's a key point. They do travel, but you still need an inoculum effect. So even if one of these tiny virus particles floats across the room and lands on you, that's probably not enough to make you sick. What you need is a higher concentration of these airborne infectious particles. And that's why ventilation is becoming obviously a very key thing. So, even if there may be a few, things in the air in a room with a sick person, if that air is being, diluted, mixed, replaced, et cetera, circulated, that really, really does decrease the risk. And that's also why outdoor situations are relatively safe by many orders of magnitude. Surface transmission is a minor, is presumed to be extremely minor, and it doesn't mean you couldn't get COVID from touching a doorknob, but it probably is not a major source. I mean, obviously, I do prefer to wash my hands before I'm going to eat, touch my face, or do anything, especially if I've shaken somebody's hand or touch a doorknob. But the key point is, sort of the The obsession of wiping every surface down in a classroom or in a hotel room, probably not necessary. Or wiping down your groceries, et cetera. Certainly, if it makes you feel better or sleep better, go ahead, do it. But at the same time, I think your efforts, if you want to prevent infection, are often better focused elsewhere. So key personal protective steps, considering all this: distancing, masking. And again, I think there was a lot of confusion and bad communication of why we mask. It protects everyone, the person wearing it and the people around them. Okay, so if you happen to be sick, certainly it'll help keep those particles, from small particles from getting out into the air. On the other hand, there's a clear protective benefit of masking for the wearer. So in case somebody in the room is sick and not well masked, this is your last line of defense. So, and trust me, I've run a COVID clinic for a good 9-10 months before we even had vaccines to protect ourselves. And all we had were masking and things like that, and none of us have gotten sick with very careful use of these protective equipment. So this is your personal gear. Think of it that way. Again, I mentioned ventilation. Obviously hygiene is always important. Of course, vaccination. So key points to think about as you protect yourself. So this is sort of a prevention model that I think really applies to COVID prevention, and you might recognize this as a lot of sort of business sort of other sort of casualty reduction theories kind of use the Swiss cheese model, meaning to prevent something, you really best you layer approach, because the reality is every individual layer is not perfect there. But if you line up enough slices of Swiss cheese, suddenly you have a very impenetrable barrier. The chance that something makes through all those holes is probably very, very small. And so that includes masking and hygiene, getting vaccinated. That's going to be your best layer these days. Distancing. And finally, judicious choice of your activities, locations, and also duration. So, the more time you spend in a risky situation, the higher the risk. So this is why if somebody jogs past you without a mask on the sidewalk, don't panic. That it's outdoors and that time around you was a split second. On the other hand, this is why I worry when I'm sitting in a room and I realize it's poorly ventilated and I'm going to be stuck here for the next half hour. And there's a lot of folks in here who are unmasked. I want to get out of there if I can, because again, the longer I'm in there, the more chance that I start getting exposed to something. So another way to put it, if you just like analogies, how do you stay dry in a storm? Layer up a gear. So think about it. A year ago before the vaccine, if we're, all we had was our masking and distancing, pretty good, but not perfect. And it felt like running through a storm with just your umbrella, which is, will keep you from getting completely soaked, but you're still going to get pretty wet. Lo and behold, we now got something called a vaccine, and this analogy should be one of your super duper expensive raincoats that is made of Kevlar, Gore-Tex, or whatever. It is fantastic. It keeps water just bounces off of it. But guess what? It doesn't cover every part of your body. What if your face and hands and maybe your shoes are getting soaked? So probably the best approach is put them together, and suddenly this is how you're going to stay dry. And this is this is my point. None of these, whether it's vaccination, masking, distancing, there's always going to be holes in it or situations where you can't apply it consistently. But the more you do them all together, the more you can really start to be safe. So again, this is there are very few things other than staying home. There's really no intervention that's going to be 100% protective, if that makes sense. So any quick questions so far?
Yes, we do have a few. Larry Stoutman asked, can you comment on some of the political inequities in policies, for example, between the US and Canada? Earlier this summer, my wife, who is Canadian, was allowed to visit her sister in Toronto with no quarantine restrictions. But if I wanted to accompany her, I would have had to quarantine for 14 days because I'm a US citizen. Also, Canadians can fly here, but can't drive here. Doesn't seem to make any sense health-wise.
you point out some very interesting things in the world of travel these days, is that every country and even within the US, different states have different entry requirements, and some of it may depend on whether or not you're citizens or residents, et cetera. And I think what you're realizing, which is obvious, is that a lot of these policies are not just about public health. It's also about other potential factors, whether it's economics, or even sometimes more other political type of issues. The reality is, they, in many ways, they are what they are, particularly when you're talking about international travel. So key point is to not be surprised, to do your research, and not only that, note that these things change. Entry, restrictions can pop up. I think in Europe is kind of, certain parts have flipped a few times now for Americans. It is an unusual time in that regard, and you are correct. It doesn't always make complete sense, but the reality is the countries and jurisdictions do have the right to make those determinations.
Thanks. Any thoughts about transatlantic travel, i.e. through Heathrow to Northern Ireland, for example, long flights, airports? And what do you do if you find yourself in an airport for an extended period of time?
Yeah, hold the airport thought. I'm going to have some slides on that. And in fact, yes, transatlantic flights, yes, we're going to cover that. So
Okay.
Any other questions?
Yes, couple. Most effective mask, cloth, blue surgical, and so on and so forth.
Okay. Okay, that's a good question. The most effective masks, are probably ones you're not going to want to wear for long periods, if you can even get them. Those would be your N95 respirators, the things that, we wear in the hospital. They are highly protective, but tough to breathe in, tough to talk in, and even though I wear them hours at the time, sometimes I can tell you it's not something I would recommend for the general public. The next layer down would be what often is being sold as labeled as the KN95 type of mask, and those are made with a highly very good filter. The main difference with that and the higher level masks that we use in the hospital is that they don't fit as tight, which is good in the sense that it's more comfortable and easier to wear for long periods. And certainly that's an easily available mask that certainly a lot of folks choose to wear. Next level below that would be your surgical masks. Sometimes they're blue, sometimes they're white. I mean, often they're coming in all kinds of colors these days, but that's the ones that are often pleated with the ear loops. And those are quite, pretty good especially for something that is quite, light and comfortable. Finally, the lowest level would be the cloth mask. Now, they are certainly better than nothing, and not all cloth is created equal. Those sort of mesh masks, or those gaiters, or, the nylon stretch things, a bit of spandex over your face. Those are probably minimal protection. And then when you talk about really tightly woven, cloth, like cotton and multiple layers, CDC, I believe, still has some guidance on different types of fabrics. Those would be more protective. Key point, any mask is better than no mask. So, and also some jurisdictions, certain parts of Europe may not accept the cloth masks. In most of the US, we're generally okay with the cloth masks. But again, if you are wearing a cloth mask, I would avoid ones like the really stretchy spandex or mesh type of things. The ones that sometimes you see the runners wearing. Those that kind of, other than just sort of physically covering your face a little bit, it really probably doesn't have a lot of as much protection.
One more mask question. If someone were to accidentally wash your KN95 mask, which they've done because they left the mask in the pocket, has the efficacy of the mask been lost?
Yeah, I would be very careful about those situations. There may be some integrity damage. It's also part of the way these materials help filter is through electrostatic charges. So washing, drying, this may really dramatically alter its performance. So something like that, like going through the wash, would definitely be a reason I would definitely try and not use that mask again and find a new one. Now, a lot of these surgical masks are meant to be single use. Generally we advise that. We often do need to reuse, and so if there's a general way I would just, obviously if there are holes, if it's damaged, if it's worn away or dirty, that's a time to definitely throw it away. But if it's, again, if you're wearing like a KN95 that's otherwise, not damaged, what you want to make sure is that, again, it looks clean, not soiled. And when you're breathing, you don't feel extensive amounts of air passing around it in any spots. You want to have the best fit possible. But end of day, again, generally speaking, try not to reuse. But if you do, again, probably just assessing it will probably help make sure, it's as good as possible. Okay. All right.
One last question.
Okay.
Are you comfortable going to a baseball game, Fox Theater, movies, things like that?
Oh, good question. Actually, I'm going to give you some guidance in a few slides on how to assess indoor spaces. Yep. All right. So, okay, back to some slides here. All right. So, you've decided you're going to break down each parts of your trip. And again, I'm just going to help you kind of think through each step and help risk assess. So, and essentially you can break it down first into two parts: your transit, which depending on how you're going, whether it's by car, by plane, by bus, each has individual sort of risks. And then your destination. And at your destinations, really two key points: where are you staying? Hotel, somebody's house, or rental, and what are you doing? And I emphasize activities because I do think really it's what you're doing on that trip probably that is, for most folks, becomes the riskiest part. So a lot of attention's on that aircraft, but to be quite honest, I think it's clear that it's really what you're doing on that trip that's the highest risk. And that goes with everything. But keep in mind, we all know that higher risk things to do here at home, go into a crowded bar, or things like that. And maybe we don't do that. But think about what we do when we travel. We tend to do more things we wouldn't do at home. And you might be there for a meeting, a wedding, a party, situations you don't have full control over. So again, that's why in many situations, travelers find themselves, in doing things that are higher risk. So let's take each part. Ironically, airplanes we worry a lot about, but ironically, I think it's actually one of the safer portions of your trip. Aircraft are still requiring masking universally. I hope it stays for the time being. And while that plane is flying and the ventilation systems are on, that air is highly filtered and replaced with HEPA filters. In fact, the level of air exchange is as good as an operating room in a hospital. It is quite good. It's probably one of the most safer indoor environments you will find yourself in. Now, that said, it is true. There's a lot of people on it from different parts of the world. So there is always a good chance somebody on it is sick. So that's where the masking is important, to keep it on as much as you can. I would try to keep it on as much as possible. If you can avoid eating meals on the flight, great. If you do have to eat, just try to keep that, period at a minimum. I generally don't think it's a good idea to be sipping, your wine for 2 hours, on a flight, like we sometimes used to do. If you really want to be strategic, and you're sitting next to a stranger, maybe while they're eating is the time my mask stays on. And when they stop eating is when I start eating myself. Those air vents that are blowing air at you, those are actually helpful. Again, ventilation is good. Mixing in, clean air is good. So if I can get that air jet blowing on me, in theory, to sort of like that, that air tunnel feeling, so that, again, any sort of, things from coming next to me will get blown away. It actually probably does help. So all those things are good, but the reality is the air circulation is fantastically good. And here's a general rule of thumb. Actually, this applies wherever you are. If the unventilated, crowded environment is the most dangerous. Now, how do you know? We don't walk around with air meters or flow meters, but our senses can tell us quite a bit. So we all know that feeling when you get into an elevator or a room that's underventilated and too crowded. It's stuffy. You can smell people. You can smell people's body odors. You can smell their perfume. Okay, that's the situation. That's the dangerous one. Okay, that's where it's like things are building up in the air. Now think about it. Every time you've been on an airplane, how often do you smell the smelly person 2 rows away from you? Not too often. How often do you smell what that guy next to you is eating? It doesn't really happen. And the reason it is because that air is being filtered like crazy, you know. In fact, I tend to smell mostly plastic and jet fuel when I'm on a flight and not a whole lot else, you know. So, and so the good news is the air ventilation levels are quite good on that flight. Now, that said, there may be other parts of that trip through the airport that are more dangerous. Think about this. We all been here, the jet bridge, okay? Not always well ventilated, often crowded. They're supposed to be spacing people out. I was traveling this summer. It wasn't happening. It was crowded. And not everyone's mask is in place. So again, these are the riskier situations. You know, you got to eat. You're at the airport. You go to a restaurant. The restaurant is crowded. You know, again, these are places where, you know, your guard might be let down and you might be at higher risk. Getting in lines that are crowded, again, if people are not well masked, if it's crowded and underventilated, it could be riskier. Now, the good news is most modern airports have pretty good ventilation systems. So, you know, the chance of you ending up in a tight, small room with a bunch of strangers is very unlikely at the airport. But again, I always sort of keep my guard at wherever I am to see where the risky situations are. So keep your mask on as much as you can. Carry your hand sanitizer on you. That way, you know, when you start eating or have to rub your eyes, you can make sure your hands are clean. Protect your personal space. Again, redefine what is your personal space. I mean, obviously you can't help keep distances on an airplane, but when you're walking through that crowded area, you know, that 6-foot bubble, you know, I've internalized it. You know, I just avoid it. You know, when I see somebody walking towards me, I just make sure, you know, we respect each other's spaces. And you know, those days where we're just packing in on those escalators and elevators, I think, you know, are probably not the best habits anymore. Let's see here. How about a road trip? So the good news is there's a lot of control in a road trip, but key points. Who's in the car with you? Are you sharing a ride with somebody who's from a different household? You know, it's, you know, or is it just yourself, your own family? I mean, if it's your immediate family or yourself, obviously it's very safe. Be careful during your stops. Obviously, you're going to have to stop probably at some point for food, a bathroom, whatever. You know, don't let your guard down. Keep assess again. You know, are those risky places? Again, if the good news is, you know, often you can just move on to the next rest stop or restaurant if something looks too crowded. And you know, as a public health scientist, I don't want to ignore the other risks of travel. You know, accidents and things like that. I mean, so you know, I mean, if you're not experienced or good at driving cross country alone, probably shouldn't do it. You know, probably safer to get on that plane. But if you enjoy road tripping, if you're a good driver, then this may be a good option if you have the time to do it. Lodging. Okay. I get a lot of questions about hotels versus Airbnbs and homestays. I think all could be good options. Hotels, your high risk area is really going to be the crowded areas, the check-in areas in the lobby, your elevators, et cetera, the restaurant, if you're hanging out there, the bar, you know, but the room itself probably should be quite safe. You know, again, COVID doesn't particularly pass very well on surfaces. You know, it can be in the air, but it doesn't stay there forever. So that room that's been vacated longer is going to be the safest. You know, what you don't want is to walk into a room right after the previous occupants and the cleaner, the maid, has just finished, cleaning it, and you go in there and you can still smell the perfume of the person that was there before. That's probably not as safe as that room that's been sitting empty for a few days. So, but you know, for the most part, if it's been sitting empty for a few hours, I mean, honestly, I'm not particularly worried about it. You know, if it makes you feel better, yes, wipe down the doorknobs, the faucets, the high touch areas. Don't touch that remote. You know, but the reality is, chances are it's a pretty safe environment. Again, watch out more for the elevators and, you know, the places where you're in close contact with folks. Rentals, obviously you avoid the crowds and they can be quite safe. Same idea. If it's been vacant longer, that's going to be safer. You can wipe some things down if it'll, help make you feel better. And it's certainly not a bad thing, but it's probably going to be quite safe. Homestays, that's the mixed bag. I mean, a lot of questions, Who are you staying with? Are they vaccinated? Are there high risk persons like unvaccinated kids? Are there going to be a lot of people around from different places? How much space will you share? You're going to be sharing a bathroom with different. So, the risk can vary dramatically depending on the answers to those questions. You may consider, if you're staying with folks, to even consider masking indoors, with when you're around them. When I visited my parents who are elderly, I actually did this for a while till I tested negative. When I was in the room with them, I wore my mask, and just as that added sort of precaution. So so really the homestays are going to be a very mixed bag. So activities. What's a risky activity? Well, there's no fixed definition. As a concert, as an athletic event, theater, wedding, are they dangerous? Well, it depends. Indoors will always be riskier. Crowds, riskier. Unvaccinated, unmasked company, riskier. So that could include a lot of kids who are, can't get vaccinated. It could mean going to a part of the country where vaccination levels are very low. Mixing of different households from different geographic locations. So, obviously you go to a bar with strangers from all over the place. Let's say you're going to a convention and there's people from all over the country. That's going to be a risky situation. A wedding with guests from around the world, or around the country, also very risky. But if it's just one or two households, if it's your own family, again, then it's much less likely somebody's going to be sick. Certain activities, unfortunately, always seem to increase risk: shouting, singing, etc. Again, things we tend to do at sporting events, concerts and bars and weddings. Again, unfortunately, that kind of increases risk too. So these are all things that to consider. It doesn't mean you can't go to a wedding. It doesn't mean there isn't a safe wedding. No, there very much could be a safe wedding. And there certainly are many safe restaurants. I go out to eat, but again, I try to stay in outdoor seating, less crowded areas, etc. This is how I assess each situation. What's safer? So, outdoor activities, masking when inside or in crowds, if you are inside at all. High vaccination coverage, limited contact with different households or persons from different spaces. So, this would be the safe sort of family get together during the holidays. Just a tight, not everyone, it's not a massive family reunion. We're talking about just, your smaller, more immediate, family. Everyone who can get vaccinated is vaccinated. Even safer, let's have it outdoors, weather permitting. That's probably how you have a safe get together. Again, this was the advice we gave last year. This year we have vaccination rates probably won't be as bad this year, but I think it's still prudent to do it, particularly if you have elderly folks who are, maybe at higher risk for infection. Cruising, a very unique category. As you know, cruises suffered the brunt of early outbreaks of COVID, among other infections historically. Inherently, there is some higher risk in cruises. A lot of people from all over the world mixing, shared spaces, tight spaces, but there's some good news. Some cruise lines are now requiring vaccination for all on board. Guess what? That means very few kids on board, by the way. Suddenly cruising sounds kind of fun. So a lot of them are very restrictive of capacities on the ship. And this has always been the case. The cruise ships actually have very excellent healthcare facilities. I mean, they're practically floating ERs. So if something did happen, you could fortunately get quick access to care, at least the very basic level of initial care. And the good news is the cruise industry is very much aware that COVID could destroy the entire industry, if they did not make these cruises safe. So it doesn't mean they're perfectly safe, but it does mean that they are trying hard. And I do, and I am very impressed that they're having all staff and passengers being vaccinated, on some of these lines. Again, it doesn't mean it's still the safest type of trip, but if you like your cruises, there's some reason to think, things are quite a bit safer than they were a year ago. Practical considerations, again, review for each destination, testing, vaccination requirements. This changes constantly. It is mind-boggling, confusing. Review CDC's travel guidance. And that CDC still does have some general recommendations for self-quarantining and testing before and after your trip. It depends partly on your vaccination status. being flexible is key. So as you might recall, if you're traveling internationally, you do have to get a negative test before you are allowed back on a plane to come home. Guess what? If you test positive, even if you feel great, you can't get on that plane to come home. So, this is a time where being flexible, it's a lot easier. Maybe if you're retired and have a lot of time, if you have a tight window for that trip, this is going to be a little riskier in general. So, in terms of proving your vaccine or test status, this is obviously become quite complicated. At minimum, obviously, we all have, if you're vaccinated, your vaccination card, that little white card. International travelers might be familiar with this, with the yellow card that was used for other vaccine requirements prior to COVID. Certainly getting that updated with your COVID shot can be helpful. But more complicated is a lot of these newer platforms, vaccination passport, digital apps, and certificates. These can help sort of obviously confirm your vaccination status. But the complicated thing is different jurisdictions and countries and states are using different platforms. So there's no one sort of app that'll get you anywhere in the world, unfortunately. So do your research in advance and what you need to do. Carry multiple forms of documentation. I would even scan that vaccination card, store it in the cloud so that if you lose it, you can access it, through your phone or email. I mean, the bottom line is, when you're, particularly when you're overseas, having multiple forms to prove your status is going to be very helpful. Let's see here. Not too many. These are just the CDC summary slides, and by the way, CDC recs do change, so this is only up to date as of now. But this is just to get a general idea of what CDC is recommending about getting tested before and after your trip and self-isolation. Key point is if you're fully vaccinated, they're much less stringent. International travel, they're a little more careful. And again, this is partially because of concern of, variants that may be emerging from overseas. And so generally speaking, traveling outside the US potentially has some higher inherent risks. And I think that's the main part of my slides, and happy to take any more questions at this point.
Dr. Wu, we have a question about how safe are indoor gyms and indoor pools?
Yeah. So I have actually started going back to my gym after gaining a lot of weight in the last year and getting very out of shape. I can tell you I've been comfortable because I'm going to a gym at an hour where I literally have one or two other people, out there. And so key point is, question is how crowded is it? Are people masked? Probably not in a gym. In my own gym, they don't have a masking requirement. But again, I'm comfortable because there's a quite good ventilation and the spacing's quite good. I don't even have to be near somebody. Obviously, you may not have that luxury. So it really may be a moment-to-moment decision. Like if you're at a hotel, maybe, there's that time of day where nobody's at the pool or nobody's at the gym, maybe that's the time I would use it. But if I went to the hotel gym and saw that every treadmill was occupied, or I go to the pool that's indoors and see, a dozen kids screaming, running around, I'd probably turn around if I was worried about, wanting to protect myself.
Okay. We have another question about professional college football games, presumably outdoors.
Oh, yeah. Okay. This is the positive part. Outdoors, again, outdoors always safer. Riskier part, potentially, if it's younger folks, maybe less vaccinated. A lot of shouting, obviously. I don't think we have great data on the actual risk. I mean, we think there's risk whenever there are crowds, but when it's outdoors, or even if it's an indoor stadium, I mean, that's a lot of air in there. You know what I mean? There's a lot, so at least it's not a tight space. But the point is, I don't think we have a lot of data to say. I would, my best answer is personally, I am not going to crowded sporting events at this time. I mean, that's just my personal risk tolerance. If it was a, predominantly vaccinated, event, let's say a college where there was a mandatory, vaccine requirement for students and staff, that would probably be much lower risk. But the reality is, I don't think we have great idea at this point. Now, that said, I'll bet you if you go to a football game, the game itself may be the lower risk. What's probably the higher risk is the parties afterwards that are indoors at the bars and things like that. So, again, try not to fixate on a single part or, something, and look at the whole picture. What are you doing and with whom through the whole event?
Okay. All right. Are there any more questions that anyone wants to add to the chat? We have a reminder from one of our members saying, be sure to cut the earpieces out of your mask before you toss them to save animals. So thank you for that.
Yeah, I can chat a little more about some, if there's no immediate questions. I mean, I think, there's a lot of talk, are we moving out of a pandemic into endemic, COVID, and, for the non-epidemiologists, it's if I had to translate that sort of talk, it's, at what point is this we just get back, this is normal, the new normal. And the reality is there is no sort of, threshold to say, hey, this is the new normal, this is not. I mean, the reality is things will continue to evolve. But what I do firmly believe is that we do need to get back to activities, including travel. But the good news is we have the tools and the experience to do a lot of these so much safer than it was a year ago. Vaccines are huge, but also recognition of ventilation, recognition of masking. And so just using these in very smart, ways, I think really does help us, get back to normal. I am planning to visit my parents again, in the near future. Again, although I am worried about numbers surging, I think it's something that can be done. Oh, one thing I didn't put in the slides, but I think it's, again, if you have access to those self-test kits, the things you get at CVS and you swab yourself and almost like the little pregnancy test, those are not bad in the sense that they're not as sensitive as a test you get at the hospital or lab, but they're quite decent at catching, highly infectious persons. So, and given that you can buy them, they're not crazy expensive, and you can do them, if you have access to them, you can even do them multiple times during a trip. That's another sort of layer of protection you can use. So if you're visiting, say, a family who is high risk, you could, and you're staying in their house, you can check yourself multiple times during that trip. And if you're positive, then okay, I gotta isolate, or I gotta, stay somewhere else. But if it's negative, the good news is you can be a little more comfortable if you're going to be letting that mask down or be doing more indoor stuff. Okay.
Dr. we have a question about animal to human transmission. I think they're talking about pets here.
Okay.
Any concern?
If you're talking about pets, not a huge concern. It is clear that animals can get COVID. Dogs, zoo animals are plenty good case reports. How well they are at passing it back to people, that's not clear. And I've yet to hear of any sort of significant outbreak or anything really linked to, say, a dog, a dog spreading it to 20 people or something like that. Mm-hmm. No, I think, in short, and the good news also is that COVID so far does not seem to be extremely dangerous as an infection for dogs and most domesticated animals. So I think there's general advice still that if you are sick, to try to keep distance from your animal pets. But for the most part, I don't particularly worry about, when I visit somebody petting their dog or something like that.
Mm-hmm. Okay. We have another question. I think it might just, you answered earlier, but maybe you could sort of expound on it. Someone goes to a theater, the Fox or a Broadway theater in New York. Any sense of level of risk?
Yeah, thanks for bringing that back up. Again, indoor, riskier, crowded, riskier, but key difference, say, than a ball game. You're supposed to be, at least for a theater, silent and, not screaming, at least not to applause. Maybe different if you're going to a rock concert, and that's a different story. So I would take each situation kind of case by case. If you're going to a Broadway show at the Fox, that potentially could be quite safe. You could put on your extra, heavy duty mask, your KN95, which I think is comfortable enough to sit in for a couple hours. If not, you can at least wear your surgical mask. You can also make those modifications like, tying the end so that it fits better around your face. But point is, the more you can sit in a less crowded area, the better. That might be tough if you're going to a very popular show like, like Hamilton or something. But anyways, point is, it potentially is safer. And I don't know if I would automatically say don't go. I mean, I would say if you can keep a good mask on for the duration, it probably is quite safe. I'd be a little more nervous about a crowded indoor rock concert in a small club, people screaming face to face, etc. Young folks less likely to be vaccinated. By the way, young folks, less likely to be vaccinated, also less likely to have significant severe illness, which means more likely to be asymptomatic and in that crowd somewhere. So that's the mixed bag with young folks. Yeah.
Okay, we have time for one more question. And that is, do you advise folks to get the flu shot at the same time as a COVID shot or booster, or should there be a period of separation?
There is certainly no need to separate them. Current recommendation is that you can get your COVID shot without any timing concerns. If it does make you uncomfortable or you'd rather space them, that's fine, but don't put off getting, the shots. So if there's a more urgent shot, I would get the COVID shot because flu has not quite hit town yet, at least not in Atlanta in full force. So, but in short, no, if you have the opportunity to get both at once, I would just get them both at once, get it over with before the flu catches you off guard.
Okay. Well, very good. I think we're running out of time. So I wanted to thank you on behalf of the leadership team of Emory 60 Plus Network and on behalf of our audience. This was very informative, very timely, very helpful. I know my wife and I are planning a trip to Belgium in February, and this gives us some great perspective on that. So I hope that we can call on you again. And again, we thank you so much.
You're welcome. Happy to do it.
Okay. So long, all.
Bye.
Thank you. Thank you, Dr.